Welcome all to the third and last webinar of the year. Some of you may know me, but those who don't, I'm Emma Cross, Project Manager of the Active Neighbourhoods for Older People project. This is Beck and I'll introduce you to her soon. The webinar today is on engaging inactive older people into physical activity and some tips and ideas. I know some of you have watched the first two webinars, but for those who haven't, if you have any problems during the webinar, please phone the number at the bottom of the screen. As a backup, everyone will receive a recording of the webinar next week and will also be available on our website. So if any problems can't be resolved today, you can view it at your own convenience. Please also share the webinar with other staff, volunteers and committee that might be interested in this project. If you're listening via phone, you will notice a small time delay between the audio and the screen. It is normal, so please don't worry. Our presenters will answer questions at the end of the presentation, but you can type questions as we go in the Ask a Question button, the dark blue icon on the right-hand side of the screen. Please don't leave questions to the end as we aim to finish before midday. I would also be very grateful for all participants to provide feedback at the end of the webinar. To submit feedback, please click the yellow icon on the right-hand side of the corner. Also, please don't forget to mute your sound. Today we're presenting will be Beck Bonini. Beck joins me in the Active Neighbourhoods project as the Health Promotions Coordinator, and then we'll have Ben Smith, who's a Professor of Public Health at the University of Sydney, and he has helped present the last two webinars. The Active Neighbourhoods team are enjoying hearing all your wonderful stories of physical activity programs being offered around your neighbourhood houses. Please feel free to share more of these stories with us and we can promote the amazing things you are doing. Please follow us on our Facebook and Instagram, and all the information about our project can also be found on our website. Thanks so much for your time today, and our team are always available to answer questions and be available live after this webinar to answer any questions. If we don't get a chance to speak to you before the end of the year, we hope you have a wonderful and safe Christmas and look forward to continue working with you in 2020. There will also be another 4 webinars and the dates will be released soon, which we're running in 2020. Now on to you, Beck.
Okay, hi everyone. As Emma said, my name's Beck and I'm the Health Promotion Coordinator. Some of you may have spoken to me over the phone or via email. So today we'll be discussing the Community Connectors component of the Active Neighbourhoods project, which we have emailed you about, just to give you a bit of a heads up. So basically the overall aim of the whole Active Neighbourhoods project is to increase physical activity for people over 65, to enhance older people's understanding of the benefits of regular physical activity and to improve their access to physical activity. And our main focus is the hard-to-reach population, which includes the socially isolated, disadvantaged, and those currently not engaged in physical activity. So we believe that the Community Connector component of this project will support these aims that I've just mentioned. It will help to increase opportunities for hard-to-reach older people to access physical activity programs. Community Connector volunteers will receive training and will be involved in engaging older people in physical activity programs at the neighbourhood house to provide a welcoming and friendly environment for them. So what is a Community Connector exactly? A Community Connector is a volunteer who links others in their local community to physical activity programs in your neighbourhood house. They promote the benefits of physical activity among the community. They can also be a point of contact and a friendly face for those who are not already engaged in the neighbourhood house community. And they can also attend a new exercise activity with a participant until the participant settles in and feels comfortable to attend on their own. Okay, so why do we have Community Connectors? Community Connectors can help to reach the hard-to-reach older people population, which is one of our aims. So this population may have difficulty finding out what physical activity opportunities are available in their community, and as a result may not be as involved, and their physical activity levels might be lower as well. They also might find it a bit scary or intimidating to attend a new group on their own, and therefore they might actually just avoid doing it altogether. And they may also have difficulty getting motivated to go to something new, and may need encouragement from someone like a community connector. So all of these points, community connectors can help with these. I think it's also important to talk about the benefits that this component can bring for your neighbourhood house as well. So neighbourhood houses have a long-standing commitment to community building and increasing physical activity in the community. Some of the data shows that the main reason that people over 65 attend neighbourhood houses is to attend the social groups. And from this, the first benefit that they found was spending time with other people, and secondly was meeting other people and making new friends. So this really highlights how important the social aspect of it all is, and that there's an opportunity for the neighbourhood house to strengthen community connection by fostering a welcoming and friendly environment where people feel comfortable. So the ideal characteristics that we believe a community should have include friendly and welcoming, so want the person to feel comfortable in a new environment to continue attending the physical activity. The community should be motivated, currently involved in a physical activity program, ideally, just so they can be a bit of a role model, I suppose, and a peer support mentor. Ideally over 65 years old, a good communicator and a good listener, so empathetic, relatable, someone who they view as a peer and not too intimidating, and has connections among the community. This is important in order to spread the word about the physical activity programs and bring more people into the neighbourhood house from the community. So for our training structure that we have put together for this community connector component, there are two different types of streams that you can choose to take to run the community connector training, depending on what suits you and your neighbourhood house best. So the Active Neighbourhoods project team, Emma and I, will be developing an online training program on how to become a community connector, which any neighbourhood houses who are interested will be able to access and use this. The way we probably recommend that the training would be delivered would be through a group setting, which is in the stream on the right of the screen. So this would involve having one key volunteer or maybe the neighbourhood house manager to actually facilitate a group learning environment where all of your volunteers can get together one day and just work through the learning materials together as a group. Alternatively, if this doesn't suit you, your volunteers could also just complete the online course individually in their own time. So the training itself will involve a couple of things. So as I mentioned, we'll be developing an online training program on how community connectors can support people to engage in new physical activity programs. So this will have some useful information on all of this and some good resources for you. And then also a resource kit which will be provided and will include some more useful information just to have on you to assist community connectors with their role. So the next steps for this component of the project, over the next couple of months, we will be developing the online course. At the start of Feb, we'll be taking expressions of interest to be involved in this project. Then in March, we plan to have training commence across neighbourhood houses through the format that suits you best, as I described in the flowchart in the previous slide. And then in April, community connectors will begin their role. So that's our timeline for now. And then an ongoing evaluation and monitoring of the program will also be happening as well. So that's a lot of information to take in probably, but it gives you the chance to have a think about the component and have a think about if it's something that you'd be interested in. Feel free to contact us. These are our contact details. If you have any questions at all, please just give us a call or email us. And now we'll pass over to Ben.
Great. Thanks very much, Beck and Emma. Hopefully you can all hear me clearly. I'm coming through my phone this morning. So I'll just double check that my audio is coming through clearly. Carla, can you hear me? I'm getting a good, okay. All right, so good morning everyone. Thanks very much for that overview of the Community Connectors program, Beck. Hope you'll all give that some thought because we think it's got great potential as a way of raising awareness about programs and making new people feel welcome and included at the activities at different neighbourhood houses. All right, so the second part of this morning's webinar, we want to spend a little bit of time talking about networks and partnerships, and particularly what we've learned from our work over the past few years helps networks and partnerships to work successfully. So at the last webinar, I presented the findings that we have gained in regard to what are the contributors to best practice for engaging older people in physical activity. You'll see that the three components of that best practice framework on the slide before you there, and they include aspects of the organisations that are offering programs, and particularly the things that reflect whether the organisations are committed and equipped, aspects of the way the leaders perform their role, and we refer to that as skilled and attentive leaders, and also characteristics of the programs, and particularly whether the programs are appropriate and rewarding for participants. So as we reflect back on what we talked about at the last webinar, you will probably recall that we highlighted at various points the important role that linkages between neighbourhood houses and other organisations in their community play in promoting awareness and extending reach and supporting the effective delivery of programs. So if you look under committed and equipped organisations there, you'll see networks is the second item that's referred to there. And there we were highlighting the important role that networks play in distributing information, in providing access to sources of volunteers who can contribute to programs, and also in providing access to expertise which might come from community health services or exercise physiologists or others that can help you in supporting participants with particular needs. And then in the second area there, under skilled and attentive leaders, you'll see that the last item that's mentioned is being connected. So that refers to whether the leaders are networked and connected to sources of information that can help them in designing and running their programs, whether they're connected to systems of referral, if and when a participant needs or could benefit from some kind of referral to external support, and also connected to other sources of advice and information that can help them with making decisions and adapting programs. And the last element there in regard to appropriate and rewarding programs, we think about accessibility, and we talked about issues of transport and cost and venues. Those are issues that are often resolved through linkages between program providers, local councils or other organisations in their area. So linkages, networks, partnerships all play an important role in expanding the reach and improving the accessibility of programs. I think as we think about partnerships and the role they play, it's helpful get a little bit of clarification in regard to what we're talking about here. When we talk about partnerships, we talk about relationships that take place when two or more organisations agree to work together on an issue of shared interest. Other kinds of words that are used are alliance, network, coalition, collaboration. They're all kind of referring to the same kind of thing, which is about linkages between organisations. One of the great things for neighbourhood houses and for those of us who are working in the area of physical activity promotion is that it overlaps with the interests and the core business of many different organisations, community health services, sport and recreation providers, local councils, private gyms, leisure centres. There's a broad range of different types of organisations which have an interest in physical activity promotion, or they may have an interest in social connection and social support, which participants can achieve through their involvement in physical activity programs. So there's enormous potential for forming linkages that are beneficial for program design and delivery. And as we think about what partnerships might look like, it's helpful to remember that there are different levels of partnerships. So on the slide in front of you now, what we've summarised are the different levels of partnership on the partnership continuum that's been described by the Victorian Health Promotion Foundation. Vic Health has developed some quite useful resources that have been widely adopted in the form of their partnership assessment tool, and it includes some great background information in it. It's available through their website if you're interested in collecting it and looking at it. But in the background information there, what Vic Health does is recognises that partnerships can take different shapes and involve different levels of interaction and engagement. And they refer to four primary levels: networking, coordination, cooperation, and collaboration. The networking is really the kind of most basic form of interaction. It's just when organisations share information with each other for mutual benefit. The kind of form that might take for a neighbourhood house is sharing information about your programs with different providers, other community services, community health services, possibly primary health networks, so that there's greater awareness around what you're offering. Those organisations have more awareness and hopefully more inclination to refer people to what you're offering. Coordination involves a high level of interaction between organisations, and usually what this entails is organisations not only having an understanding of what each other is doing, but in some way modifying what they're doing to reduce duplication. So what we've seen in the area of physical activity promotion for older people is organisations deciding that they will offer activities of different types. One might be offering gentle exercise, another might be offering walking football, another might be offering aqua fitness. The organisations might decide to concentrate on different groups. So one might concentrate more on sort of the high needs, high dependency area. One might concentrate more on the more active and well older population. So by being aware of what each is doing, there's greater opportunity for reducing duplication and including and achieving greater coverage of programs. Cooperation is when there's, again, a high level of engagement, and this is where there's more likely to be resource sharing and greater time commitment and trust shared between the organisations who have a partnership. So what we also see quite often are organisations such as neighbourhood houses cooperating with local councils. And the council might be assisting by providing, for instance, transport. Council might be assisting by subsidising programs so that they can be offered at a lower cost. Neighbourhood houses might cooperate with community health services, and the community health services might provide staff who can occasionally visit and provide input in regard to the program and how particular participants might be supported. So in those kinds of relationships, there's a greater investment of resources to improve the delivery of programs that are being offered by an organisation. And usually what there's a recognition of is that by cooperating, that those different organisations can achieve more together by sharing resources. And the highest level of partnership that's referred to there is collaboration. Collaboration usually takes the shape of new initiatives. So this is when organisations such as Neighbourhood houses get together with other organisations in their community and they share their understandings about particular unmet needs and consider how they might work together to address those unmet needs. And often that means some kind of new strategy, some kind of new program, and the different organisations share their understanding about how that program can be designed, how it can be promoted and delivered in a way that's going to address those needs. And a result is usually some kind of new initiative. So it might be a new initiative, for instance, that's a physical activity program for a particular cultural group, an area that's been not very involved in programs in the past. And the different organisations would bring together their expertise. It might be possibly having cultural expertise, it might be having resources, it might be having venues and so forth, to offer a new program. And in the course of that work, they will define their mutual responsibilities in the delivery of activities, and usually they will look at how they're progressing over time. Sometimes in strong collaborations, there's memoranda of understanding, which are written agreements about the role of the different partners. So those are the 4 levels of partnership that have been described by the Victorian Health Promotion Foundation. In our work in exploring the attributes of successful partnerships for physical activity promotion for older people, what we've done is we've reviewed the pretty substantial literature, the reports and case studies and experiences that have been written. And we've also spoken to a number of providers of physical activity programs for older people. And we've developed 3 short videos. We're going to provide links to those videos through the Active Neighbourhoods for Older Australians website. And what I'd like to do now is play one of the videos which we put together through our conversations with Hyde Hampton Neighbourhood House and discussions with them about the kinds of relationships they have with other organisations, how those have benefited their programs and what some of the things are that have helped those partnerships to work well. So I'm going to now ask Carla to play this 4-minute video, and you'll hear Melanie Teague, the coordinator of Hyde Hampton Neighbourhood House, speak, and you'll see a little bit of visuals about the kinds of physical activity programs that they're offering. So I'll hand over to Carla now to play that video.
So I'm the manager of 2 community centres, and we provide low-cost, socially inclusive activity and events for all of the community. But certainly we have a high proportion of our members that are in the over 60-plus age group. So for them we have a range of exercise activities or physical activities. So there's strength training, chair-based exercise, other things like Tai Chi and yoga, Pilates, line dancing. So trying to offer a breadth of activities for people as they age. Particularly within Bayside Council, there are a cluster of neighbourhood houses and community centres, so we meet regularly or quarterly. We talk about what our programming is, try to dovetail where possible. That's where we find out who's providing what classes and what demographics they're serving, so we sort of have a conversation to make sure that we're not overlapping. So those linkages, I guess, have been facilitated by Council, and also our Neighbourhood House Victoria, they provide us with networkers who oversee the groupings of neighbourhood houses come together to share this information. We also liaise with a working committee made up of representatives from COTA, the Caulfield Rehabilitation Hospital and several recreation centres. So we also meet quarterly with them just to talk about what's being offered in the area, what their strategic plans are for developing programs in this Bayside, Glen Eira, Kingston area. Why we invest our time and energy into being on these committees, and for me making contact, is just to better inform us ourselves of what is out there, ensuring that there's no replication. It's also informing us of the demographic that they are serving. They perhaps maybe identify what issues are coming up for their members or a particular age cohort, so I use that information to then inform the delivery of services out of my centres. The knowledge that we share is really useful for when we go to organise programming, or even in the event of just replacing or substituting a teacher for a week off. So it is very useful having these links with these other stakeholders and really good, strong relationships. So I guess for the centre, it strengthens our relationships with our other organisations in the area, which has been really important, and it gives you a bit more credibility within the community to be able to say, look, I'm in touch with these community centres or the local rehab hospital, and I think it's really important for our members, but it also strengthens the capacity of our staff who have peer support then, I guess, when they have issues around delivering activities for older adults at our centre. It absolutely allows us to better understand what is being delivered and coordinating with the other centres in our area and ensuring that we're not replicating at a particular time or a particular program, or where we need to fill those gaps and identify those gaps for us, and that's really important for our service delivery. And I guess the sharing of information around the demographics of the area, how other centres and organisations notice the changes in terms of age, the type of perhaps not necessarily injuries, but what people might be presenting with. And for us, we're particularly interested in addressing social isolation and loneliness in our area. It's been identified as a rising need or a growing concern in this community. So having those linkages and being able to have those conversations, which is all informing what we're delivering here to do with, exercise for older adults, has been absolutely invaluable. I guess it's also about understanding that sometimes what might not necessarily be best for your centre might be better for your overall community, and that you need to trust that someone else is able to deliver that if you're not unable to. But I guess overall it is all about improving the health and well-being of our community, and that's probably what underpins everything that we do.
So you've heard there the story from Hyde Hampton Neighbourhood House about the kinds of linkages that they've developed with other organisations. Their partnerships are more at the networking and coordination level. We've also collected some stories from the University of Third Age at Whittlesea in Melbourne, and also from Sunbury Community Health Service, and their partnerships are more at the cooperation and collaboration end. So I encourage you to get on to the Active Neighbourhoods for Older Australian site and to watch those videos, because they tell a lot about the experiences that these organisations have had and what they've learnt about the development of successful partnerships in physical activity promotion. I recognise that neighbourhood houses have enormous experience in undertaking partnerships for different aspects of your work. And of course, we respect that, and we understand that you've got a lot of insights that you're bringing to your efforts to build partnerships with other organisations in relation to physical activity. What I'd like to do to finish off with this morning is to present some of the findings that we've collected from our review of literature and from our consultations with a range of different physical activity providers in relation to things that have been identified as contributing to successful partnership. I'm not going to spend too much time on these, just really to walk through some key points, and you'll be able to read more about these factors and some of the other things that have been identified in the resource that will be available through the Active Neighbourhoods website. And of course, we respect that you might have additional insights that are not reflected in these points that we've been able to pull together. But the things I want to spend a little bit of time finishing off and talking about this morning are four areas really that contribute to partnership success. The first is thinking about the conditions and the capacities that exist for partnership establishment. Secondly, the steps that support partnership management and operation. Thirdly, the important arena of communication and relationships and some of the things that are important there. And finally, some considerations in relation to strengthening partnership sustainability. So I'll just walk through a few of the key points, not all of the things that we found. And I'll just let you know that the way things are ordered in each of the 4 slides that I'm about to walk through now reflect the rating of importance that was given to these different factors by the group of agencies who are part of our consultation. So, looking firstly at conditions and capacities for partnership, what we heard about as being important, firstly, endorsement by managers. So those in a leadership position in the organisations are supporting and committed to the formation of partnerships. And what that means usually is that the people who are actually engaged in interacting with others can make more timely decisions because they can be comfortable that they're doing something that's in alignment with what their organisation is committed to. Secondly, that there's a clear recognised need for partnership. There's a view by the different organisations and understanding that they can achieve more by working together than they can achieve by working independently. And what helps is organisations spend a little bit of time thinking about the greater impacts that they can have by sharing information, by coordinating, cooperating in different ways. And thirdly, the other basic condition or capacity that supports the development of partnerships is mutual understanding. And that refers to different organisations understanding what their respective core business is, what their goals are, what their policies are in regard to different areas of their work, what resources they've got, and things to do with the ways that they work. Are they working more from a service delivery model, or are they working more from a community development, grassroots model? Those kinds of understandings enable organisations to feel that they can work comfortably together and to have some sense that they can navigate and proceed in a way that's not going to sort of take them out of their area of core business and their normal ways of working. So those are a few points that came out as being important in relation to conditions and capacities for partnership. The next things that we heard about and read about in relation to developing strong partnerships related to how the partnerships are managed. And there are 3 things that are shown there on the slide. Again, these are in the order in which they were ranked by the agencies that we consulted with. The thing that was highlighted as most important in relation to how a partnership is managed is having a clear implementation plan. So that means having clear, realistic timeframes with assigned responsibilities for the actions that will be taking place. This probably applies most to partnerships that are of a cooperative or more coordinating type of a nature or more collaborative, less so obviously than with those that are really a bit more at a networking level. The next aspect of partnership management that we heard about as being important was clarification of a shared vision or a goal or clear objectives in regard to what you want to achieve. And it's important that those objectives align well with the core business of each of the partner organisations. And the third thing that we heard about as being helpful for the management of partnerships is taking some time to define the roles and responsibilities so that each partner is clear about what their contribution is going to be, that they're comfortable with that, and also so that the different organisations can have some kind of realistic expectations about what they can each contribute. So those are some things that have been referred to as helpful in the area of the management of partnerships. The next area, I would say, stood out of all of them as being the most important in regard to developing successful partnerships. Probably doesn't surprise you, I'm sure, as organisations that do a lot of work in the area of partnerships. It's all about relationships and the quality of those relationships and the way that people express their engagement with the activities that are being undertaken. So I've included 5 things here which stood out as being very important in our review of literature and our consultation with agencies. First is the commitment of the agencies to the work and the participants or representatives in those agencies to the work and the ownership they have of it, their personal investment and their energy that they put into the work. And that's shown by the participants making an effort to be informed about the need, about the activities that each organisation is contributing to addressing that they're actively engaged in discussions, that they're involved, they're respecting the processes and the decisions that arise in the partnership. All these things that reflect the genuine commitment by each of the organisational representatives in the work that's been done. Effective leadership was also an important thing that was identified, particularly when we think about partnerships which involve cooperation and collaboration. There's often a chair or some kind of a coordinator or a leader, an instigator, a person who's a facilitator of the partnership. And when there is somebody in that role, people talk about the importance of that person being knowledgeable about the issue, about different organisations, that they're respected for that knowledge and their experience, that they're enthusiastic, and that they're inclusive and fair in the way that they work with the other agencies. So those are all attributes and practices of the leader or the facilitator. The next area of relationships and the way that people work in partnerships is communication and information sharing. And there's a lot in that, but really what it boils down to is regular, clear communication, often in a structured way, in a formal way, but also through informal channels so that the relationships are being continued and people are up to date on what's going on. Fourthly, trust and respect. These are attributes and values that different representatives of the organisations bring to their interactions, and very important for the formation of good working relationships where people are comfortable possibly to step out or to do things, to invest in new areas of activity because they trust and respect the other participants in the partnership. So it's shown through mutual understanding, through an absence of hidden agendas. That comes through communication, through taking time. We heard it also comes from practices of direct communication and organisations just being open about what their needs and priorities are. And the final thing in relation to relationships and how partners work together is inclusive and transparent decision making. All of the contributors to an initiative having an opportunity to have input into decisions that are made and feel that they've been heard and that the decisions that are made have respected their priorities and their capacities. So that's the third area, relationships between partners, which, as I said, really stood out above all of the others as being vitally important for successful partnerships. I imagine this probably is consistent with your own experience of working with different agencies over time. And the last area that I want to spend a little bit of time acknowledging is the steps that can be taken to build partnership sustainability. We want those relationships that we've talked about to contribute to lasting arrangements so that programs can be developed, expanded and delivered over time to meet the needs of the community. So three things I want to highlight here, which we've heard about as being helpful for sustainable partnerships. The first of these is flexibility. We all know that organisations have their own core business, their own funding environment that they're working in, their own complexities. And partnerships are more lasting when there's a degree of flex, when there's some allowance for organisations at times possibly lowering their level of engagement because of other things that they need to do or to adapt the way that they're working in the partnership because of other priorities and considerations to them. So flexibility is really important. Secondly, that there's clear mutual benefits and rewards for each of the contributing organisations, which justify the time, effort and resources that partnerships are contributing. Those rewards can take the shape of recognition. It can take the shape of sharing of resources between the partners, which helps them to improve what they're offering respectively, and take a range of other forms which help organisations to see that possibly that their profile is being raised through their work in the partnership, that they're gaining things that can help them to demonstrate that they're meeting their goals and objectives. The final thing to mention is that partnerships are more likely to be sustainable when there's skill development, and also when there's some kind of support for the organisations who are participating in the partnership. And that can take place through sharing of expertise, maybe through meetings and workshops that are conducted where organisations can benefit from each other's knowledge and skills in particular areas. And also it can be developed by recognising where the partners might want to draw on external skills, bring in people that can help them with solving problems and possibly designing new and innovative initiatives that improve what they're offering. So that's the fourth area, partnership sustainability. So I said we've identified a range of things that contribute to successful partnerships. We'll provide links to this information and also to the videos through the Active Neighbourhoods website. Also, I want to just mention before I hand over to Emma that we've recently sent out a link to a Survey Monkey, which is asking you to describe the kinds of linkages that you have, be they network linkages or coordinating relationships, cooperating relationships, or collaborative relationships. We'd be interested just to know where you're starting from at this point in time. We don't have great expectations. We're particularly interested in relationships that you've got in place that are supporting your physical activity program. So please take a few minutes to complete that Survey Monkey. It really shouldn't take you more than a few minutes. We'd appreciate that because over the next year, we'll be, particularly in about a year or so's time, we'll be checking in with you again to find out whether any of those relationships have expanded or developed to support your physical activity programs for older people. So thanks very much, everyone, for listening. I'm going to hand over to Emma now, and I think there'll be opportunity for questions.
Great. Thanks, Ben and Beck, for your time presenting today, and I want to thank all the neighbourhood houses who took the time out of their day to view this webinar. If you feel that you've got any questions after this, you can email us at anoa@msk.org.au or give us a call. Thanks for all those houses that already returned their partnership survey. But if you haven't, we've actually extended the due date to the 13th of December so that you can, so today's webinar can help you completing that survey. And one of the questions was, do we give you a copy of the slides? Within the next week, we will email everybody that's registered for this webinar a copy of the webinar plus the slides, and it's also available on our website. So once again, I want to thank you all for attending today, and we will see you all in the new year, and we'll let you know of the last 4 webinars we'll have next year. Thank you very much. Bye.